Does letrozole thin the endometrial lining in fertility treatment? Imagine trying to get pregnant and wondering if your medication is helping or hurting your chances. Letrozole is often used to help women ovulate, but does it affect the lining of the uterus? The good news is that research shows letrozole generally does not thin the endometrial lining. In fact, it may even support a healthy uterine environment. Unlike clomiphene citrate, which is known to sometimes cause the lining to become thinner and less receptive, letrozole tends to preserve or improve the thickness of the endometrium. This is because letrozole works as an aromatase inhibitor, which temporarily lowers estrogen levels. Since estrogen is vital for building and maintaining the uterine lining, the short-term reduction does not usually lead to thinning. Once the medication is cleared from the body, estrogen levels rebound, allowing the lining to develop normally. Studies have shown that women taking letrozole often have endometrial thickness measurements that are adequate for implantation, typically around 5 millimeters or more. Once this threshold is reached, increasing the thickness further does not necessarily improve pregnancy chances. This suggests that letrozole supports enough endometrial development without risking thinning. In comparison, clomiphene can sometimes cause the lining to become thinner, which might reduce the chances of successful implantation. For women with endometriosis or other fertility challenges, maintaining a healthy endometrial lining is especially important. Letrozole's ability to promote ovulation without compromising the uterine lining makes it a popular choice. It also has a shorter half-life, meaning it leaves the body quickly and reduces the risk of prolonged estrogen suppression that could harm the lining. In summary, letrozole does not typically thin the endometrial lining. Instead, it often supports a receptive uterine environment, which can be beneficial for women undergoing fertility treatments like ovulation induction or intrauterine insemination. As always, it is essential to discuss your specific situation with a fertility specialist, who can tailor treatment to your needs and ensure the best possible outcomes. Remember, every person's body responds differently, so personalized medical advice is key to success.